The first exercise that we're going to perform is a TFL and hip flexor myofascial release with the lacrosse ball. So as you can see, Matt is placing the lacrosse ball in the crease of the hip and then going to rotate the lateral portion of the ankle down towards the floor and continuously move back and forth. If it's okay in that area, you can try moving your body or configuring your body to a new position and then go through the same techniques. You should feel the muscle raise as you're rotating the leg down towards the floor. The second exercise is going to be a gluteal imperio formas release with the lacrosse ball. So we're going to place it on the outside portion of the hip and wiggle our way up and down on the region to relax the musculature. Another technique can be done by extending one leg out to the side while having the heel come towards the groin. And we're going to internally and externally rotate the hip. And when you're rotating the leg down, you should feel the musculature raise. The third exercise is going to be a hamstring release with a lacrosse ball. We're going to place the lacrosse ball right next to the ischial tuberosity, which is the hamstring attachment point. Sit up nice and straight, and with the opposite arm trying to reach for your foot. You're trying to hinge back and forth, trying to stretch out the backside of the hamstring. Other techniques can be applied as well by trying to potentially picking up your hips and shearing left to right across the hamstring, as well as rotating the leg in and out. So doing an external rotation or an internal rotation and then hinging should actually elicit a different stretch. The fourth exercise is going to be a hip flexor stretch. So we're trying to split the legs as wide as possible while having the knee of the front leg stacking over the ankle there. Then we're going to contract the core, trying to draw in the belly button towards the spine, as well as driving the front hip and contracting the glutes down towards the hip, and slowly raise up to this upright position. To get more out of the stretch, you can actually raise the arm up overhead so you can get some more hip flexor stretching here, and then you can try to rotate or do some side bending in order to elicit a different stretch. The next exercise is going to be a hip flexor stretch. So while taking the knee of the front leg and having it over the ankle, you're trying to stack it, contract your glutes, draw your belly button in, and trying to drive your hips forward in line with the ankle down on the floor. To get more out of the stretch, you're going to raise the arm up overhead. Then coming out of it, we're going to go into an adductor stretch, where we will stretch out the inner portions of the thigh. So with this, you're trying to maintain a nice neutral lower back, trying to drive your hips back and forth. To elicit a different stretch, you can try to internally and externally rotate the leg, while also trying to contract the inner portion of the ankle towards the floor to stretch out the groin more so. After performing some internal and external rotation of the hip and also contracting it to the floor to stretch out the adductor, you can then segue into a supine figure 4 piriformis stretch. So as you can see, Matt is crossing one leg over while contracting the ankle up towards the ceiling in order to preserve the knee. With his hand, he's going to then try to add some more external rotation, trying to push the knee away from him to feel a deeper stretch in that gluteal region, and also threading his arms through the legs in order to bring that other leg up. You can also add a extension and flexion of the ankle joint in order to improve range of motion there and to feel a different stretch. The last exercise is going to be a high gastroc and a low soleus stretch. So we'll start with the forefoot onto the wall with the leg fully contracted straight. Then press your forefoot into the wall and perform a contraction and then relax, and then repeat that same cycle. To get at the ankle joint, you can then bend your knee closer to the wall and perform the same technique of contracting and relaxing while at a slightly bent angle.